Thank you so much for visiting Alabama this year. I am deeply grateful for your time and letting you come and visit with the incredible men and women that work there, see the work that's being done, figuring out how we can partner to continue to change lives for the better. Really, really appreciate it. And then also, and here we're going to have another challenge with how to say your name. Is it Mura? How do you? Yes, how do you?
Marazzo.
Marazzo, geez Louise. We are very proud, obviously, you having been at UAB and to see you in this job now. You obviously know what a special place UAB is, the tremendous work that is done there, and look forward to working with you in your new position. As you both know, in Alabama, over a third of our 67 counties are classified as maternity care deserts, areas without access to birthing facilities or maternity care providers. Last fall, 3 more Alabama hospitals announced closures of their labor and delivery departments, leaving both Shelby County and Monroe County without access to labor and delivery services. Additionally, Alabama has the highest maternal mortality rate in the nation. I am of the mindset, as I believe probably the men and women sitting at that table are as well, this is a crisis we should be able to fix. If you look back to 2019, NIH launched the Implementing a Maternal Health and Pregnancy Outcomes Vision for Everyone, the IMPROVE initiative. Madam Director, could you speak to the importance of this program and why the NIH felt so strongly that standing up the IMPROVE initiative was necessary, even without a sustained funding source?
Oh, absolutely. Thank you, Senator. You know, pregnancy-related complications related in the deaths of about 1,200 women in 2021. We're still waiting to see the figures coming in for the last couple of years, but it was just an enormous jump. And with much higher rates in Black women, which is also terrible. And so we're really, IMPROVE is one of many efforts, a really important one, but one of many. We are looking to tackle this problem because it's multifactorial. It's mental health, you know, so our Institute of Mental Health plays a role. It is also, to a certain degree, associated with substance use disorder as well, which we know, you know, all of these things intersect.
And that's why it is so critically important. I just want to say thank you. Improving health care for women before, during, after pregnancy is truly vital. And I really am thankful for your leadership in this space. And I want you to know that I want to continue to partner. As you mentioned, though, obviously this research funding is so important, but yet this research is so important, but really lacks a sustainable funding source. And so last month, I was proud to partner with Senator LaFonza Butler from California on the NIH IMPROVE Act, which would authorize in statute and provide consistent funding for this initiative. And so I just want to thank all of you and the NIH staff for providing your offices to help us with technical assistance on this, to make sure that we could get this important bill out there. I am committed to continuing to work with Senator Butler to finding a way to getting this passed into law. As you mentioned, not only is Alabama the highest maternal mortality, it disproportionately affects the Black community, and we need answers, and we need them now. So we're going to keep working on that to help with, to help with America's maternal mortality crisis. And I want to say, I know I'm almost out of time. 2 quick questions. When it comes to CRs, which is what we end up seeing happen here, unfortunately, and I want to commend Chairwoman Murray, I want to commend Vice Chair Collins. This committee did its work last year. We finished in July 27th, all 12 bills out of committee. Unfortunately, we did not get those to the president's desk until 236 days later, 174 days into the fiscal year. Can you speak very quickly about what a CR does to your agency? Oh, look at this. I get a reaction from the whole crowd. And can you just speak very quickly to that?
I'm sure we're the same as all of government when we don't know exactly what anyone knows this. If you don't know how much you have to spend, it's very hard to plan and make all of the strategic decisions we need to make that don't come at the very end of the year. We do the best we can and are certainly grateful for our funding, but it is challenging.
Madam Chairwoman, would you allow me to ask one more question? Thank you so much. Just last question. In your visit to Alabama, you were able to see some of the research that we are doing there and, how our community, our diverse population in Alabama is really a great place for clinical trials. Could you just speak to that very quickly as to why you feel like those things match up so well?
So it is absolutely critical that we serve our populations that are having so many of these extraordinary needs that all intersect, that have to do with community in a very effective way with our clinical trials infrastructure. And so that is why we are launching a new clinical trials network devoted toward primary care to do exactly that, to get into the communities and doctors and clinicians on the front line, like the ones that we were able to visit in Alabama and in West Virginia and in other parts of the nation. And we're excited about this. It will be all of NIH effort to work with these communities to get the research that they need.